Hello. All right. I wanted to make sure my door was closed so I didn't have anybody pop in while I'm doing the live, including my cat. But you guys, if you're in on the American side, I hope you had a wonderful holiday. Thanksgiving, you had some time to rest, spend some time with your family, or if you didn't celebrate Thanksgiving last weekend, you just rested and had a good Thanksgiving weekend or just a regular weekend. I'm in Calgary, so it is a cold spell right now. So it's making it easier and easier to stay home and not do anything. So I was excited to stay home and not do anything this weekend myself, or this past weekend. So last week I launched my Miscarriage Support Program. And this week we're going to continue the 5 conditions that might be preventing you from getting pregnant or staying pregnant. And the last topic today that we're talking about is fibroids. So this is the freebie that I released probably about 6 weeks ago now. If you don't have it, go ahead and comment the words 5 conditions, and I'll make sure to get it your way. And really, we go over these 5 most common conditions. So we've gone through PCOS, we've done endometriosis, we went through autoimmune, and then we went through luteal phase defect or low progesterone. So the last one that's left is fibroids. And if you're watching this, whether you're watching this live or you're watching it on replay, I would love to know which one of these you are impacted by the most, because I get a lot of different feedback in terms of, I've been diagnosed with this, that's why I can't have a baby. But then as we have a deeper conversation, or that's why I haven't been able to carry to term, as we have a deeper conversation, you realize that, hey, maybe I've just stopped looking after my diagnosis because no one has ever really looked deeper into my diagnosis. I've been just told what the diagnosis is, and then that's that. And what I really want to challenge you guys doing is, and shift your beliefs and shift your perspective on health, is that our body isn't static. So just because there is presence of a fibroid, endometriosis, or progesterone is low, there's something that's causing that to be there. And so if we remove the cause, or we put you in a different environment, give the body the nutrients that it needs, it's constantly changing. The body is constantly changing. It's not static. And so the things that are found within the body are also not static. And I would love to shift this perspective for you, that it's absolutely possible to cure and to heal and, to have happy and healthy babies. But it's not going to be a quick little fix, especially when it gets to be more complex in terms of the conditions. So endometriosis, PCOS, autoimmune conditions, fibroids, like I said, these are complex conditions. So to say that I'm just going to change my diet and lifestyle and hope that it works, don't get me wrong, that is the entryway into fixing these issues, but it's only the entryway. And it's like, that's what you need to do just to enter the game. Okay, it is not level 10, level 20 of the game, anything like that. It's just, you literally are just entering to play the game. So if I can help you understand that, so you don't feel so discouraged from all the effort that you are putting into nutrition and lifestyle. Now, what I'm going to do in the new year is really December, I'm going to take time to focus with you guys on how to go through December, taking care of yourself, drawing some boundaries, learning how to say no, taking care of your body so you actually start to feel rejuvenated and rested and relaxed heading into the new year, instead of overwhelmed, frantic, anxious, all that jazz. Because, I'm just prepping for an initial consultation. And this couple has been struggling for 7 years with infertility. Now, they had 1 child in there, and they would like to have more than 1 child, but they can't understand why they can't get pregnant. And after looking at the form, one of the things I ask is, how is your energy? So I haven't even had the initial consult yet, but I already can tell what's happening here. And the energy for the female is a 5 out of 10. That's really bad, you guys. You're running on half empty. Sure, you can look at it half glass, the glass is half full or half empty, but at the end of the day, you're here instead of here. And in order to be able to reproduce and make happy and healthy babies, we need to have energy and vitality. We need to have this energy and vitality like overpouring. It has nowhere else to go. And I find more and more women And more couples are on the opposite end of that, and they're frustrated. And I understand that infertility itself causes a lot of stress, but we really want to shift gears towards taking care of ourselves instead of focusing on this external thing that we actually have very little control of. What we do have control of is our own system. And so learning how to take care of that, understanding how it works. And I guarantee you, once you understand how it works and what health actually truly feels like, the pregnancy occurs, and it's a lot easier on the body, and the pregnancy itself is, of course, much better. And then the end result with a healthy baby. So that's really going to be the focus for December, for the remainder of December. But today, let's talk about fibroids. I hope you guys are as pumped as I am. And I want to make sure I did it. So what I want you guys to understand is that fibroids are really, really common. Up to 77% will develop fibroids sometimes during the childbearing years. 77% of women, okay? I've realized that there's a bunch of different studies, but 20 to 50% already currently have fibroids. And so I have kind of this picture of fibroids in here to help you understand that they can be in many different places, and they come in many different sizes. What they are, though, is growths that are made of smooth muscle cells and fibrous connective tissue. Now, it's important we're going to get into why would that happen, because that's, at the end of the day, that's going to be really important to figure out before we want to get into the treatment. If you don't understand the why and you just go in and surgically remove them, the chances of them coming back are really, really high because you have not addressed the why. So it's a smooth muscle cells and fibrous connective tissue is basically what the fibroids are made of, and they can be as small as a grain of rice or as big as a melon. So imagine having something as big as a melon in your uterus, right? Or around your uterus or around your fallopian tubes. We can imagine that that's probably going to cause quite a bit of discomfort, not just around the menstrual cycle, but in general. There's not a lot of room here, meaning we have like 7 feet of intestines in there, and then you have your uterus, your fallopian tubes, and then you have your stomach, and your lungs are coming down in there. So there's not a lot of room. And so if you have this thing that's growing, it's going to start to push on structures. It's going to impede some blood flow. And then, of course, it can cause, whether it's constipation and other digestive issues, or it actually will push down on the uterus, again, depending on where the fibroid is, and prevent your body from being able to get pregnant or stay pregnant, depending again on where this guy is growing. So they are classically diagnosed by a physical exam and ultrasound imaging, but please know that some are undetected. So if they're as small as a grain of rice, there's no imaging that's going to be able to detect it, but you might still experience the symptoms, which is heavy bleeding it's the most common cause. The most common symptom, pelvic pain, and then having bleeding between periods. If they're really large, now you're going to get into that constipation, low back pain, and infertility, because they're actually pushing and impeding on the structure. So if they're blocking the fallopian tube, so even if you ovulate, that egg can't get through. If it's around the uterus where the baby's trying to implant, there's no room for it to implant. Or if it tries to implant but can't grow because the fibroid is there, cutting off circulation and cutting off nutrients. So really, really important to get this assessed if you're experiencing these symptoms. Okay, so we want to understand if we have it, first of all, and the next thing we want to get to is why do we have it? And what causes it, this is why what I think is most important to understand. The more you can understand what causes the condition, the better treatment you're going to be able to have. And that's really, really important. So every single condition that you look up in research is going to say the pathogenesis is unclear. I mean, maybe there's some that it's clear, but for most, they'll just say it's unclear because, you guys, every single condition has a genetic predisposition. Again, I was just reading something on Instagram, and it's like, oh, I have this skin condition. It's genetic. It has nothing to do with digestion or diet and environment, but I'd love to know any suggestion. Every condition has a genetic predisposition. Every single one. You might have a genetic predisposition to fibroids. Someone else might have a genetic predisposition to endometriosis. Another person might have a genetic predisposition of autoimmune conditions. If I put 3 different women in the same environment, the same toxic environment, I should say, their bad genes are going to turn on. And one woman will express fibroids, one will express autoimmune condition, and one will have an endometriosis. That's just what being a human being is. We have our own unique genetic code. We're like our own unique snowflakes. And that's why it's really important for you to understand how your body's talking to you and how the environment that you are in is causing the genes to either turn on or turn off, and both good or bad. So just because there's a genetic predisposition does not mean you cannot do anything about it. So I really want you guys to shift that perspective, because I have a lot of people who just think and assume that it's because my mom is this way, it's my dad this way, it's just the way that I've always been. Your body is not static. It's just like a plant. If you put a plant into a dark corner in your room and barely water it, it cannot thrive. If you take that same plant and put it in a different pot, water it, give it sunshine, fertilize the soil, that plant will flourish. You are that plant. We are not static. Okay, I really, truly, guys, I want you to understand that and feel that inside your body, inside your bones, because it's true. I can't tell you how many women are just, oh, it's the way that I am. It's not the way that you are. It's something that's in your environment, and it's something that you're not aware of quite yet. And the goal is to bring awareness, okay? The goal is to bring awareness. So the main thing, again, that comes down with fibroids is going to be that it is an estrogen-dependent tumor. So the things that are going to play around estrogen, and we've talked a lot about estrogen in the past, is environmental exposures, because guess what? A bunch of the stuff that's in our environment now has endocrine disrupting chemicals. Endocrine disrupting chemicals usually mimic estrogen, especially things like BPA, so the plastics, right, that we see, and there's phthalates, even pesticides and herbicides and glyphosate, that all play a role in how our hormones are made, and then how much they're made, how well we're getting rid of them. And so it's going to cause an issue. And so the more estrogen you have floating around, the bigger the growth is going to be. There's also a theory, if you will, that the body is trying to protect you from some sort of a chemical or a toxin, and that's why it starts to form these growths, that these growths are actually filled with chemicals and toxins, and the body doesn't want it to circulate around it, and that's why it's forming. And that could be cysts, and that could be, you know, fibroids and growths, connective tissue, all that jazz. So I thought that that was very interesting, because again, every time I see a condition, I think about, why would the body do that? Why would the body start to form these fibroids, right? These connective tissue, fibrous glands, if you will, growths in the uterus or around the uterus. So I want you to be just as curious, or more curious if you can be, and just ask why. Why would the body do that? Okay, because there is always the reason why. So the uterine development is particularly sensitive to window to environmental exposure. So basically, prenatal endocrine disrupting chemicals is the one that helps to increases this tumor growth in both rodents and human epidemiological studies. This again is coming down to figuring out your health before getting pregnant. We are passing on things to our children without even knowing it. Our parents pass things on to us without knowing it. And so I think this is a really great opportunity for us to come in to a new way of being, into a new space, and say, something is off. I want to fix my health so my child doesn't have to deal with this. Because if we're not aware, what's happening is we're exposed to these endocrine disrupting chemicals in vitro that is causing these genes to turn on. And that's why you feel like that's just the way that you have been. Because part of that, of course, is true. But the part that's not true is that you can't do anything about it. You can absolutely still change, even though you've been that way for as long as you can remember. It's just going to take time. It takes time. The body takes time. I think the red blood cell cycle is about 3 to 4 months. And, from immature to, from start to life to end to life. And then there's like bone cells that are a little bit much slower, and then collagen cells that are much slower. But then there's cells that are much faster, like in the stomach, in the skin. Those things shed a lot faster. But basically within like 7 years, you can have a totally new body, which is kind of cool. So if you change your diet, it's not to say that it's going to take you 7 years to get pregnant. I'm not saying that. But the point is that if you keep chipping away and keep stacking that progress, you'll see that it changes. And I use my husband a lot as an example, because he came from a standard American diet. He was overweight as a teenager. He struggled with a lot of stuff and a lot of injuries as a kid that we're still trying to work through and break up and let the body heal. And it's working. It's just taking time. The other thing that I wanted to bring attention that is there is a strong correlation between low vitamin D levels and uterine fibroids. So that could be a really simple fix. Again, measuring your vitamin D levels is really easy. I find just doing that measurement gives you some insight, but not all the insight. Basically, if your vitamin D levels are low, but you're in the sun all the time, then we're asking why. Is your immune system using it up too much? Is there some sort of infection or something, environmental toxin that's basically burdening your body, and so you need a lot more resources in order to be able to function normally? We want to ask those deeper questions, okay? Because basically, fibroids themselves don't actually cause infertility. It just depends on where they're located, because they might need that surgical intervention, because they might be impinging on the fallopian tubes, there might be in the inner lining of the uterus, and if they're larger than 5 centimeters, then of course they're going to need to be removed. They're just too big, and it's just going to be too crowded, and you're going to experience way too many symptoms. And even if they don't have an impact on fertility, but you are experiencing the symptoms of having heavy periods, painful periods, pelvic pain, constipation, and you found out that you have fibroids, number one, you guys, what you want to do is understand why the overgrowth is there. And this is where some good testing is going to come into place. So things like vitamin D, do you have high estrogen level? What's your environmental toxic load? Because if you need to remove the fibroid, you remove the fibroid, but you don't do any other changes, the chances of it coming back are really, really high. And this breaks my heart, because I have a lot of women who come to me after having a surgery removal and then saying, oh my God, I removed it, did all of this stuff, and it just came back. And all that tells me is that we never got to the root cause of the problem. It's like cutting the weed just at the top and then hoping that it doesn't grow back. You have to get the roots. You have to get the roots, and sometimes you have to get the soil around the roots and then replace it in order to make sure that it doesn't come back. And I look at fibroids in the same way, and I mean even with endometriosis, when we see that the tissue is just coming back even stronger and harder, you have to understand what's causing it. So that's the main lesson here, is get that proper diagnosis. Because my biggest gripe with the conventional medical system is that if they detect it, then they'll just remove it and say, well, hopefully it won't come back. That doesn't leave you feeling very empowered or in control. You're just crossing your fingers and hoping that something doesn't happen. That creates a lot of anxiety for us humans. That's normal level of anxiety, because you are out of control in your system. And truthfully, this is the only thing we have control of. That's the only thing we have control of. The other thing is, if you have a lot of symptoms, but you can't detect it, then it doesn't mean that you shouldn't do anything about it. You can still do something about it, because your symptoms are enough. Your symptoms are enough, and your comfort is important. So if you have crazy heavy periods and you have a lot of pain, and every sign and symptom is pointing to the fact that you have a fibroid, just because it's not detected on the ultrasound, just because it doesn't need surgical removal, we still need to move through it. Okay, we still need to treat it. We still need to help you. We still need to support you. And the way that you do that is you actually advocating for yourself, asking deeper questions. And if you're sitting in front of a practitioner and they don't seem like they're listening, they don't seem like they care, that's your cue to go to another practitioner. That's your cue to go to another practitioner. I think about it like dating. If you went on a first date and the person barely looked at you, they didn't listen to you, I highly doubt you would go on a second date with them or a third date. I would hope not. Anyways, this is the same thing with a medical conventional system. Okay, you guys, I hope that you found this helpful. Please let me know if you can throw it in the comments. What was the most interesting thing that you learned about fibroids? And if you want a copy of the handout, if you have not gotten the freebie yet, go ahead and comment 5 conditions and I will get it to you. And then in December, we're going to get into some really great self-care tools and tips and boundaries and how to feel rested and rejuvenated after the holidays, instead of groggy, tired, and anxious. Much love. I'll see you guys next week.